I was a preemie when I was born and spent a lot of time at the doctor with asthma and bronchitis. And I know when I went to the doctor, she would give me a breathing treatment, help me feel better, and she'd give me a lollipop. And so when I was 4 years old, I said, that's a cool job. You get to help people feel better and give them candy. And so I said I wanted to be a doctor. And so that relationship that I had with Dr. Stewart from the time that I could remember all the way even up till now really inspired me to want to be a doctor. She had to kick me out of her practice when I was 21. She told me that, I was an adult now. But I always just valued the relationship. She was one of the most important people in my life as my doctor. I looked up to her. And so I wanted to be that, for my community. I wanted to help take care of people, be there for them when they had challenges, and then also be there for them with their victories and celebrations. So, even now, I model my practice after hers, and I give my patients a lollipop at the end of every visit, just as a kind of an homage to her.
I grew up in a rural area of Alabama where our family doctor was the person that took care of us. When I was around 5, my dad was diagnosed with cancer and spent a whole summer in the hospital, and I was there a lot and was really just touched by the physicians and the way they cared for our family.
The reason why I became a doctor was I really believe in the art and science of medicine. It's a perfect blend of science and humanity in a way that makes the world a better place.
The reason I became a doctor is when I was young, every time I would have a fever, I would have seizures. So I ended up in the hospital frequently, and as a result of that, I loved my doctors.
I was motivated to be a doctor as a young man in high school. I lived in a community with a very large hospital. Many of my friends' fathers and mothers were doctors. And I was just so impressed on how they worked so hard and cared for the community in which they lived, and that inspired me to do the same.
No one really brings flowers to the psych hospital, and there was one patient there who was the president of his fraternity and had been accepted to law school, and his future was nothing but bright, and then he had a manic episode, and his family had kind of abandoned him at the time, and it was just heartbreaking. And to watch him improve and get better and get back to his life was extremely rewarding. And that kind of just set the tone, and from there I was hooked.
We all joke that the cliche med school interview answer is that I wanted to help people, but that's actually true. My parents say that, I've been saying I wanted to be a doctor since I was 6 years old, and I never changed my mind. And really the desire to help people and to make people feel well and be well is at the core of why I practice medicine.
So I wanted to become a doctor from the time I was in first grade, and so I really don't know why I wanted to be a doctor other than that my parents really respected our physician when I grew up, and I really thought that they took great care of me and took great care of our family, and it was important to me to be able to do that for other people, to be able to serve my family and my community by taking great care of them.
But I always felt inspired when I went to work and worked with my colleagues and my mentors and the other physicians and saw how they really cared about their patients. And it was enough to inspire me to keep going, because the end result was a great thing of being a noble service of caring for patients.
I still love what I do. I love that I practice in the area close to where I grew up on. I'm on my 3rd generation of patients, and it's a wonderful profession.
I just think I have one of the best jobs in the world. It definitely has its challenges, but there's nothing more rewarding than seeing a patient feel better after you've seen them really suffering. So, all of the struggles aside, it is a beautiful career, and I wouldn't trade it for anything.